Good afternoon. We're here with Humboldt County Public Health Lab Manager Jeremy Corrigan for the July 30th media availability. Thank you for being with us.
Sure.
Today we have just a couple of questions. So before we get started, can you start off by speaking to testing in the county?
Sure. Our laboratory began testing for COVID around February of earlier this year. We started off with the CDC assay. And we started off with about 20 to 30 samples a day, and over the last couple of months have ramped up to about 85 samples a day. To put it in perspective, last year and every year prior to that, we did about 150 to 200 PCR tests for the whole year. And over the last 4 months, we've done 6,000 COVID PCR tests, which is a huge dramatic increase. And so we continue to ramp up our testing capacity due to the demand here locally. And with that is adding additional equipment and new testing options for us. So recently, we were able to get a new testing option for COVID, which is the TAC-PATH Kingfisher option. We obtained a Kingfisher extraction equipment, which will dramatically increase our capacity for testing, about threefold, in fact. So what that does, currently we have other extractors, but they're pretty small, and they do about 8 samples per hour, and another one does about 14 samples per hour. So over an hour period, we can only extract 22 samples that are prepped up for our PCR step. With this new piece of equipment, we're able to do 96 samples in about 23 minutes. And so it should triple our capacity in about 2 weeks. So we're really excited about this opportunity. In addition, we were able to procure about $200,000 worth of equipment and supplies from the state of California to do about 10,000 tests. So we're supplied and ready to go for the next phase of this response.
Nice. Happy to hear that. So getting into the questions, are lab tests to detect the coronavirus restricted to people who have COVID-19 symptoms?
No, they're not currently restricted to symptomatic individuals, although we must prioritize our testing here at our laboratory. So we're one of the only laboratories that are here testing COVID locally, and we need to ensure fast turnaround times. So we have a testing prioritization chart that prioritizes different populations. So we want to focus on the symptomatic individuals as well as protecting our healthcare workforce. And so we also focus on congregate living facilities. And so we do some asymptomatic screening in those populations because they're really important to protect them.
With regular tests, it often takes days to get results, by which point the person may have already infected others. Couldn't that type of testing put the Humboldt community at greater risk?
Absolutely. Turnaround time for testing is vital for us to conduct a adequate communicable disease investigation so that we can prevent and control outbreaks and further spread of COVID-19. That's why our laboratory has been investing in equipment and supplies for us to increase our capacity to respond to those specific instances and cut down on turnaround time. Currently, our laboratory focuses on symptomatic individuals and the healthcare workforce, but with tripling capacity here, we should be able to help support some of that asymptomatic screening that many of those tests are being sent out, and the turnaround time is reaching up to 7 to 10 days.
Thank you very much for joining us today.
Thank you for having me.